Did you know that diabetes affects millions of people worldwide? This chronic disease doesn't discriminate and can impact anyone's life at any age. But what exactly is diabetes, and what are its risk factors? It's important to know that risk factors for diabetes include a family history of the disease, leading a sedentary lifestyle, obesity, having gestational diabetes mellitus, GDM, experiencing impaired glucose tolerance or fasting glucose, and a body mass index, BMI, of more than 25. Let's delve deeper into this topic today, shedding light on these risk factors and unraveling the complexities of diabetes. In the realm of healthcare, we encounter primarily four main categories of diabetes, which include type 1, type 2, gestational diabetes mellitus, GDM, and other types of diabetes like steroid-induced diabetes or pancreatic diabetes. Type 1 diabetes, often appearing at a younger age, is closely associated with our hereditary factors. On the other hand, type 2 diabetes, a more common variant, is usually attributed to lifestyle habits. Another type, known as gestational diabetes mellitus, GDM, emerges during the pregnancy period as the name indicates. Steroid-induced diabetes can be a consequence of long-term usage of high-dose steroid medications. Lastly, when the pancreas is compromised due to disease or damage and fails to produce adequate insulin, it results in pancreatic diabetes. Beyond the well-known type 1 and type 2 diabetes, there exist other forms of this condition that are equally important to acknowledge. Gestational diabetes mellitus, or GDM, is one such type that manifests during pregnancy, affecting both mother and child. Steroid-induced diabetes is another form, triggered by prolonged use of high-dose glucocorticoids commonly used in treatments for numerous medical conditions. Lastly, we have pancreatic diabetes, a form of secondary diabetes, which arises when the pancreas is unable to produce sufficient insulin due to damage or disease. These types, though less common, are crucial to understand in our journey to manage and overcome diabetes. The understanding of diabetes is a critical first stage in its effective management. You may be pondering on the ways to control this condition successfully. The answer lies in a nutrient-rich diet, particularly the concept known as a healthy plate. This concept segregates the plate into three primary sections. Half is vegetables and fruits, a quarter is protein, and another quarter is complex carbohydrates. This balance ensures that your diet is rich in fiber, vitamins, and minerals, while simultaneously controlling the intake of carbohydrates and fats. With regard to fruit consumption, it's crucial to limit the intake to 2 servings per day. For instance, 1 small apple can be considered as 1 serving. It is optimal to consume fruits on separate occasions to balance sugar intake. As for carbohydrates, it's critical to choose complex carbohydrates which consist of longer chains, decompose at a slower pace, and help in maintaining blood glucose levels. In contrast, refined carbohydrates like white bread and white rice are broken down swiftly, causing a sharp spike in blood sugar levels. Hence, choosing alternatives like whole wheat bread, brown rice, and whole wheat pasta not only provides sustained energy, but also minimizes the likelihood of blood glucose fluctuations. These dietary choices are significant not only for maintaining steady blood glucose levels, but also for avoiding long-term complications such as heart attacks, strokes, and kidney problems. Physical exercise is undeniably pivotal. Aim for 150 minutes of moderate intensity workout per week. Exercise plays an indispensable role in managing diabetes. Moderate physical activity can increase insulin sensitivity and aid in blood sugar control. Remember, a combination of physical activity and a balanced, nutritious diet truly forms the best medicine. Shifting our attention now to foot care. This essential practice helps prevent long-term complications such as heart attack, stroke, renal failure, and foot ulcers. Therefore, the daily routine should include meticulous foot inspections for any ulcers and immediate medical consultation at the site of any infection symptoms. Covered shoes are a must-have in your footwear collection for additional protection. This combination of everyday foot checks, prompt medical attention when needed, and protective footwear is a significant stride towards averting serious health complications. Failing to properly manage diabetes through a suitable diet, exercise, and foot care can escalate into serious complications. These include heart attacks, strokes, renal failure, and foot ulcers. Central to this management is achieving good glycemic control. Maintaining your blood sugar levels within the recommended range is key to preventing these long-term complications. With proper management and good glycemic control, you can not only effectively control diabetes, but also significantly improve your quality of life. Lastly, daily tasks such as regular follow-ups with your doctor carry immense significance in determining the success of your diabetes management. It's equally important to include daily checks for foot ulcers, signs of which may include redness, swelling, or pain. If you notice any of these signs, seek immediate medical attention, as these could be signs of infection. Appropriate treatment plans and prudent medication management will empower you to take control of your health better. Moreover, wearing covered shoes can provide further protection for your feet, reducing the risk of injury and infection. Thank you for watching today's video. If you have any questions about diabetes management or want to learn about other topics, please tell us in the comments. Don't forget to give a thumbs up, share, and subscribe to our channel. See you next time.